Hypertension Awareness Series Episode 6A. White coat hypertension. Yes, that is a real term. White coat hypertension. When blood pressure only rises in the clinic or in hospital. Doc, my pressure is only high in your office. At home it's normal. Should I get worried? Many people are told that their BP is high, but only when they're in hospital or in the doctor's office. At home, their readings look normal. This is what is called white coat hypertension, and it is far more common and more important than most people realize. So what is white coat hypertension? White coat hypertension happens when the clinic or hospital BP is more than 140/90, while the home BP monitoring is less than 135/85, or 24-hour ambulatory BP monitoring is less than 130/80. So BP looks high in the clinic or at hospital, but it is normal in everyday life. How common is white coat hypertension? Guidelines show that 15 to 30% of people with high clinic BP actually have white coat hypertension. It is more common in older adults, in women, in fast clinic visits, in people who feel anxious in medical settings. Many people are misclassified if home monitoring is not done. So why does white coat hypertension happen? It is driven by the body's stress response. 1. Sympathetic nervous system activation. When we feel stressed or anxious, adrenaline is released. The heart rate increases, the blood vessels tighten, and BP rises temporarily. Number 2, conditioned stress response. Past illness, fear of bad news, or hospital memories can trigger BP spikes even before the cuff is applied. Number 3, vascular sensitivity. Many patients already have early arterial stiffness. They have increased vessel reactivity to stress. And this is not just nerves, it reflects early cardiovascular vulnerability. Is white coat hypertension harmless? No, white coat hypertension is not harmless. Data shows that people with white coat hypertension are more likely to develop sustained hypertension. They often have other cardiovascular risk factors, are overweight, diabetes, abnormal cholesterol. They may already show early heart and vessel changes, and they have higher cardiovascular risk than people with truly normal BP. So it is an intermediate state, not a harmless condition. So what do guidelines recommend? You confirm diagnosis using home BP monitoring or 24-hour ambulatory BP pressure monitoring, regular follow-up and repeated monitoring. There is strong lifestyle interventions and medication only if overall cardiovascular risk is high or the BP progresses. Treatment should never rely on a single clinic reading. So what can you do today? Use a validated home BP monitor. Measure or monitor your BPs morning and evening for about 1 week. We will talk about how to measure the BP correctly. Maintain a BP log and share it with your doctor. Early detection prevents future disease. Remember, white coat hypertension is a warning sign. With awareness, healthy habits, and proper follow-up, many people may never progress to full-blown hypertension. So remember, the next time your BP is high in the doctor's office, that is a warning sign. Start lifestyle measures and do your home monitoring. So stay tuned for our next important episode where I talk about masked hypertension, when BP is normal in the clinic or the hospital but high at home. Should you worry? Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.